This conference will now be recorded.
Hello and welcome to RAISE Mrcog Part 3 Introductory session. And I'm Dr. Rashmi Patil, Consultant Director, Chief Mentor of RAISE Academy. And today I'll be focusing upon the November 2024 exams, especially for the beginners batch. It's going to be very much helpful. Welcome all of you. And I would say, like, from here, there is no way that you're going to look back because your MRCOG journey has already started. For all the people who have cleared your part 2 and looking forward for your part 3 exam, and this is your first attempt, or in case if you have taken a second attempt also. And for the people who have given their part 2 exam but want to start with the beginner's batch, so this is a wonderful opportunity, and I would tell you why you're supposed to choose RAISE Academy courses. Eligibility, as I would say, to sit for the part 3 exam must have completed part 2 exam. So once your results are available, you will be getting to fill your all assessment of training, get it approved, and then you are like you'll be required to fill in the form, and they will send a mail as well that you're eligible to sit for the part 3. And once your assessment everything is approved, then officially you will be getting a mail to sit for the exam. But again, the booking everything I will be telling it towards the date of booking. Now official RCOG website gives us all the details, and I am sure that all of you are well versed with the RCOG website, and the upcoming congress, the other details, everything is available, and even the further dates that have been announced. So as of now, the exam dates are going to be 6th and 7th of November and 11th and 12th of November 2024. The venues that they have chosen is Chennai, Malaysia, UAE, London, Delhi, and Singapore. So these are the details that RCOG has displayed on their website, and depending upon the band, you are supposed to pay the MRCOG Part 3 fees. So you can click on this link below to see that which band you belong to as well. Now about the November 2024 exam dates, please all of you make sure that your home address and email address are up to date before Monday 29 July. Okay, if any concerns are there, please go through this and update your home address and email address, because they would see that you're belonging to which area, and that particular area exam you will be getting to sit for that as well, and you will be getting to choose a date as well accordingly. And assessment of training, you have to submit. For example, there is a 4 years of clinical experience in the field of obstetrics and gynecology. For example, you have done your post graduation for 3 years, 1 year of a senior residency, or post graduation of 2 years plus 2 years of senior residency. Overall, it would require 4 complete years of clinical experience in the field of obstetrics and gynecology, and then you have to apply this for your assessment of training. Once all these things are applied, the college will take at least 4 weeks of working duration, and then they will approve this. And priority booking would open on 29th of August. It closes on 2nd of September. But trust me, most of the seats get over within like couple of minutes. So 29th August itself, the moment that the booking is going to open up, you are supposed to do your booking for your part 3 exam. The booking window would close by 9th of September. The second booking window would open on 5th of September. So the priorities are different, and the remaining candidates would get their mail for the second booking on 5th of September. So I'll be sending all the alerts as well in the group, so that you will be able to be aware about what the upcoming dates are, and you're supposed to be ready for your booking details. Now results are going to be released tentatively on 11 December 2024. So these are the important dates that you need to mark in your calendar. Now about the part 3 exam, this is going to be a clinical assessment. Whatever knowledge, skills, attitude, and competencies that you have, part 3 exam would concentrate on this. And after clearing this, you will be awarded the prestigious membership of Royal College of Obstetrics and Gynecology, that is MRCOG. And later on, this is an essential waypoint for all the UK trainees to pass from the core training to get into the higher training of ST6 and ST7 as well. And this clinical assessment would consist of 14 tasks. So I'll be showing about the clinical assessment and how you're supposed to go through the tasks as well. Now, if we clearly go through this, part 1 and 2 is more of the knowledge, your single best answers, and the extended matching questions that have been there. So all of us know about them, and once you have cleared all those things, it shows that you have adequate knowledge to deal with the uh, part 3 assets. Now, whatever you have learned in your clinical, the knowledge that you have gained in your part 1, part 2 exams, this is going to be applied for your part 3. So it is going to be the clinical application of all the 14 tasks in the circuit. So every cubicle is having a module, and these are the modules that you need to concentrate: teaching clinical governance, core surgical skills, post-operative care, antenatal care, maternal medicine, management of labor, delivery, postpartum problems, gynecology problems, subfertility, sexual and reproductive health, early pregnancy care, gynecological oncology, urogyne and pelvic floor problems. So these are the 14 modules, and each task would be based on one of this module. Now these stations have 2 minutes of reading time to go through the entire task or the case scenario. Once you go through that, then you will get inside the cubicle and you have 10 minutes to have a discussion. So to perform that task, you have 10 minutes. Either there is one person sitting over there who is your clinical examiner who is going to have a structured discussion or a kind of a viva voce with you regarding the scenario, or there is a simulated patient who is a role player who is sitting there, and then you're going to have a discussion with her. You need to talk to her as though she is in your OPD, she's in your ward, admitted, pre-operative, post-operative, or she has come for a breaking bad news counseling. So you need to deal with her. And some station also has a lay examiner. So they are not from the medical field as such, but they have a good assessment of your communication skills, the way you counsel them, how you gather the information, and then how you manage the scenario as such. So there are different tasks. One is a simulated patient task, or an SPT that we would call, where the clinical examiner and the role player are sitting. Let me tell you that clinical examiner is not going to interfere in your simulated patient task. It's only the conversation between you and your role player that will happen. In the simulated patient task with the lay examiner, you have an additional lay examiner sitting and observing you. And all of them, they are going to mark you, the clinical examiner, lay examiner. In a structured discussion, there is only a clinical examiner sitting, and then they're going to assess you. And they have a set of questions and they have the markings. And as and when you answer that, they're going to mark you accordingly. Now, once the 10 minutes are over, then a bell rings and then you go to the next station or the next cubicle. You start reading the next station immediately. There is no gap between the two stations that you could relax. So it is 2 minutes of reading time, 10 minutes of performance, the bell rings again, go there, 2 minutes of reading time, the bell rings again, you get inside the cubicle, perform for 10 minutes, and again the bell rings, you go to the next station. So that is going to continue. Earlier there was online exam as well where the screen would change, but now it's going to be face-to-face examination only. Now in all these stations, what are they looking for in a candidate? That how safe a doctor you are, how nicely you are able to communicate with the patient and relatives, and how is the communication involving your colleagues, your back, like the other specialities who are there, and then how you involve them in the case management, how do you gather the information accordingly, and the applied clinical knowledge as such. So all these things you are going to assess it as well, and then you have to um, talk to the role player, talk to the examiners, gather the information accordingly, and then you're going to distribute all these the knowledge that you have gathered over there. So all these things are going to be there. Okay. And about applied clinical knowledge, whatever information or the things that you know from your part 2 exam, the guidelines that you have studied, all the information would be applied for your part 3 exam. So, but it is in the term of the patient friendly language, as I would say. So you need to connect with them in the simple language that you're going to explain them. So use the patient friendly language as such. And about gathering information, I would also be telling about how to go ahead with one by one. So patient safety, communication with the patient and relatives, they're very much important. And in the lay examiner, again, these 5 domains could be judged. And in the structured discussion, again, the 4 domains are going to be judged. Now the scoring would be like 2 is a pass, 1 is a borderline, and 0 would be like a fail. So how does it depend? So they have certain asterisk points in their answer sheet or mark sheet. So whenever you are the role player is asking you some questions and all, and you try to answer that thing, and the examiner has certain set of points. So if you're answering whatever is required for that particular domain and the asterisk point is marked, it means that you will be getting a score of 1. So if there are three asterisk points, so you need to answer all the three. So you need to extract that all three important points from the role player. Then it's a kind of pass in that particular domain of that station. So in case if you miss on one asterisk points, it would be like a borderline. If you miss two asterisk points, it would be like a fail in that domain. No, it's not like entire station, but fail in that domain. Now, similarly, the other domains are also being judged. So overall, it is the domains added together and a global marking would be given. So whenever you're going to discuss, or if you there are certain points also that if the candidate does not elicit this things, it is means fail in the patient safety domain. So even if you have asked about the asterisks points, but if you're not eliciting that important history of an allergy or anaphylaxis to some peanuts, so that they are carrying even the adrenaline shots with them, so it's a very life threatening kind of a situation. In that situation, if you're not eliciting that history, so even though you have told about the important safety points of other things, so you may fail in the patient safety domain over there. So these information gathering are very important, and how quickly, how smartly you are supposed to gather the information. This is also extremely important. So here, uh, yeah, just a minute. Okay, just a minute. Okay, yeah, I've shared this link again. Okay, so in the information gathering, I would say that you need to introduce yourself. So it is like, hello, I'm Dr. Patil, one of the doctors in the antenatal clinic today. And can I confirm your name, age, date of birth? And how would you like me to address you? So this is the basic introduction which everybody would expect. And if it is a structured discussion, just introduce to your examiner that, hello, I'm Rashmi. I've read the instruction and I'm ready for discussion. So you are just going to have, keep it very crisp, very formal, and please make sure that you do not fumble at the beginning. It is just going to be like any other day. Just relax and you need to give those exams. So those 3 hours, the best thing is your self-confidence. The way you introduce, the way you begin your station, the way you end your station should be like wonderful. A good beginning and a good ending is going to get you a lot of confidence, and you will not fumble in your station. Your words are going to be clear, and just make sure that you're practicing this on a regular basis, right? And the reason for the visit, for example, yes, Kelly, I understand that from your GP letter you're here today to discuss about these things. Is that correct? So just kind of a confirmation. So this information gathering right now, I am going to tell, or it's in terms of any outpatient department, how they come and how we are going to introduce. There are different scenarios. So in the course, as and when the situation comes, how to introduce in an emergency, how to introduce for the person who is like, angry or waiting for long. So all those things and all keeps modifying. So in this introductory session that I'm taking, this is a general information gathering when you're doing in an outpatient department. And about the agenda, you can just say, since we're meeting first time, can I ask you some quick questions? And if required, I may have to examine you in presence of chaperone, and depending on that, I may have to give you some test. And they will discuss the evidence-based management options available. Is that okay with you? So these things you can modify your own sentences. It is not like you need to memorize them or this is the only sentence that you need to talk. Nothing like that. Just be yourself. Every person is unique, every person's style is different. You just have to understand that what you need to communicate in that agenda, right? So you're going to ask some information, you may have to examine her, do some test, and then discuss the evidence-based management options. So this much should be your agenda. So each one of you, please practice it in your own way. It is not necessarily that whatever is given you have to by heart that or memorize that, because if you keep thinking or keep memorizing things, at one point if you get stuck, then you're lost. So do not do that. Your fluency is very much important, your confidence is very much important. At any given point of time, any station, any question the role player asks you, you should be confident enough to answer. So that is how I want all of you to be prepared, because whatever stations, anything, whatever recalls are there, whatever questions have been framed before, after, anything, it keeps changing. RCOG keeps revising its stations, and they keep changing the role player instructions. They add on new points, they remove the old points. It is not exactly how it appears in every exam, right? They can communicate with you in a different way. They can ask you a different question. So it is not like, okay, previous station I have read like this, but in this station, though the scenario was same, the role player was asking different questions. So it is not like, I don't want you people to prepare only on the previous stations or whatever the recalls or anything is there. You have to be clear that whatever the role player is going to ask me, I'm going to address that. So that should be your intention. It should never be like something role player asked and suddenly you lost all the way, and you're thinking that the question is out of the kind of syllabus or something. But no, you, whatever the role player is going to ask you, that is going to connect you through the asterisk points. So those are important for you to pass, because some way she may feel that okay, you're not going to touch this point, so that the role players also have a set of instructions to ask. So if the candidate does not address these points, then please ask this question. So in that way the role player will ask you question that will lead to the asterisk points, which can get you the maximum points. Towards the end, you can just say, I'll give you certain information leaflets. So for the people or the beginners, patient information leaflets are something like a handouts that you give to the patient. And every hospital, they have different set of information leaflets which they have modified by themselves. RCOG also has a set of patient information leaflets which is freely available in the website. They are written in the patient friendly language. Okay, so most of the time they are the patients, everything nowadays, they are well read, they know so many terminologies. So you don't have to stress on smaller things, but most of the patients, they really know certain medical terms and all. But when they are not able to understand, you have to explain that, especially when it comes to management and all. You need to clearly draw some diagrams. There is going to be a paper pad and a pencil that is given to you during that exam, and you just have to draw something, show them that okay, this is the womb and these are the tubes and your ovaries, and this is the neck of womb that is called cervix. And right now I'm going to explain these things. So you can just scribble something and draw them and show how it is. And you, at the end of your station discussion, we give the handout. So it is not like you're going to actually give some paper there in the exam. It's just telling her that I'll give you certain information leaflets. That's it. So you don't have to touch your patient, you don't have to give anything, you don't have to do anything to your role player. They're just sitting there. It's a kind of discussion that is going to happen. Even if you're saying that I will examine you in presence of chaperone and just confirm the findings, you are not going to touch your role player. Okay, they are just sitting there and you're just communicating with them. You just have to tell that these things I'm going to do. Is it okay? And she would say yes. And in the beginning, you don't know what the patient has come to you for discussion. If you're not very much sure, if she has some 5 6 complaints and you don't know which is the important one, so what you should do is you can just ask her, can you tell me more about your concern? In that way, she'll come out with the information that she's supposed to give you. So she would say, I'm having more of pain, or she would say, I'm having a bleeding problem. So either it is menstrual related or it is pain factor that is more bothering her. So she would tell the symptom which is bothering her more. So it is a good way to put up an open-ended question in the beginning. Can you tell me more about your concerns? And then take a detailed history about her complaints. For example, if it's menstrual related, your history would be more on your menstrual cycle. If it is something pregnancy related, you would ask about the first trimester something. So first trimester symptoms you're asking her. And depending on the trimester she is, you're concentrating on those symptoms. And is there any other concern? So just once you take those history, it's going to be a quick history. And similarly in the medical management, so in that module when I'm teaching, I will tell you how to gather the medical aspect of the HOPI and the antenatal aspect of the HOPI. So both the things have to run simultaneously. You're not only concentrating on her pregnancy, you're also concentrating on the medical condition. If it is heart related, then what are the questions? If it is respiratory system related, what are the questions? So you have to concentrate in that way. So every module will be dealing with a general template first, and then we will be discussing the stations that are there in that module. So I'll be guiding towards every module how the approach of information gathering, or how the approach towards the management it is going to be. And about menstrual history, can you tell me about your periods and when did you have your last one? So if it is crossed beyond 3 to 4 weeks something, you may have to offer her a pregnancy test accordingly. And this is one of the important safety point. So PCO patient, she will tell that my last cycle was 3 months ago. So don't just assume that she's PCO, and she might have had an intercourse also, you may never know. Or she's planning for pregnancy and she's PCO and she has now come to you because she's not getting pregnant. So the first thing that you're going to offer is a urine pregnancy test, because you don't know whether she would have conceived because she's actively trying. So just don't presume that because she's PCO and amenorrhea is there, it is related to the PCO. You do not fail to offer the pregnancy test whenever it is required. And obstetric history, I would rather say, ask the question, have you been pregnant before? She would say yes, one ectopic, one abortion, so miscarriage, and one cesarean, one IFT. Anything history she gives you. But if you tell her, do you have children? She may say no. But she would have had history of 2, 3 recurrent miscarriages, something, or an ectopic also. So better to ask, have you been pregnant before? Can you tell me about them? So this would be an ideal question. And contraception, by chance, if this is required, are you using any contraception? For example, she has come for a preconception counseling and you find out that the HbA1c is too high. You may have to tell her to use effective contraception until she gets her HbA1c to optimum level, and then she can plan for the pregnancy. This happens so many times in a clinical scenario, right? And do not fail to tell them, because having conception at that particular HbA1c may be detrimental as well for the fetus. And STI screening, whenever required, you may have to offer ectopic histories. We are expecting chlamydia, tubal blockade stations, infertility. You're expecting that she might have a chlamydia infection. So you can just signpost a little bit. You can say a few personal questions. May I? You can say, I need to assess your sexual health, and can I ask you a few questions? So just keep it simple. Do not hesitate. Do not feel sorry. Nothing to be there. And have you treated for any sexual infection in the past? You can ask it that way also. And then you need to check on that. So you need to ask just a simple question and then take it forward. So amongst all these sentences, one sentence would be enough. The best one I would feel is few personal question. May I? And just go ahead and ask, have you been sexually active, or have you been like treated for any sexual infection in the past? So and screening of cervicals, the assessment, everything. So cervical screening, you just have to ask wherever it is relevant. So if a patient has come with Down syndrome and she wants to discuss about confirmation on Downs, we don't sit and ask for cervical screen for them, right? So just wherever applicable, you need to tell. She has come for a Leeds procedure or something, there it is really important what were the screening test, what it was showing that she is undergoing this procedure, and any other history, cancer history, anything important. So cervical screen is Something which I wouldn't ask in all the stations, but only when it is relevant. Please do not miss on this. And were they normal? So keep it simple. And about medical history, do you visit your GP for any regular conditions or any medications that you're taking on daily basis? You can ask it that way. Allergy is equally important. Are you allergic to any medications? So it could be penicillin, trimethoprim, metals like nickel, substance like latex. Some food allergy could be there, egg, peanut, anything. So ideal would be, are you allergic to anything at all, or are you allergic to any medications, metal substances, food? You can ask in that way also. And surgical history, have you undergone any surgeries on your tummy or down below? You can ask in this way. Past history, admitted for any other reasons. And social habits, keep it very simple. Again, I would say a few personal questions. Do you smoke? Do you take alcohol? Do you take any recreational drugs? So just keep it simple. You don't have to think twice before asking. It is okay to ask these questions, right? So just keep it simple and ask these quick questions. And family history, any family history of concerns. If I would expect downs or something, cystic fibrosis, I would say any family history of concerns or any genetic conditions that are running in the family. If I'm thinking about VT, any history of clots in the legs or lungs in your family, any history of sugars, high pressures, and if it is cancer related, breast, CA, ovary, endometrial cancer, colon cancer, any cancer breaking bad news has come to you and you need to elicit the family history. In that way, you may have to tell that any history of cancers in the family. And about social history, keep it simple again. What do you do for living? Whom do you live with? How is the support at home? Or you can keep it simple. You can ask her, are you safe and happy with your partner? All these sentences, trust me, just choose one of them. You don't have to, memorize or talk anything like that. Just be open, just be simple, and have your own sentences. So then you have to just rule out domestic violence and make sure all these antenatal, all these women, they're all safe. They can come with you with chronic pelvic pain, with some hidden history of domestic violence or hidden history of child sexual abuse. So we just have to elicit these things. So as and when we are dealing with stations, we'll be discussing upon the hidden agendas as well. And about mental health, have you ever felt down, depressed, or anxious in the past few weeks? I wouldn't label that as 2 weeks, 4 weeks, 6 weeks, nothing. Just say few weeks, that should be okay. So it would mean somewhere between your 2 to 4 weeks, right? So you don't have to label them exactly. And just say, have you felt down, depressed, or anxious in the past few weeks? Again, I would say mental health. This is not a must question in so many stations. Okay, the patient has come with a ruptured ectopic and you're not bothered about how she's feeling past 2 weeks. No, but again, if the patient is post delivery, she's having some crying spells, you're not sure about her mental health, how it was before. Is it now that she's facing such problems? You don't know. Chronic pelvic pain, it would be like an abnormal uterine bleeding and she's suffering with that. It would be an SUI which is bothering her, PMS which is bothering her. Those stations, mental health, yes, this is really important. And antenatal, you just have to ask this question to make sure that she is happy. Blood group, again, aware of your blood group, any reservation for transfusion if need arise. Some may have Jehovah's Witness. So these are the people who refuse the transfusion of blood and blood related products. But however, other medications can be used. So I think all of you must have gone through this in your part 2 exam also. And about BMI, this is a very sensitive question for your part 3. So I would prefer to ask, are you aware about weight to height ratio? That's BMI. And is it of a concern to you? If she says like, yes, it is 35, 38, something like this, I wouldn't directly give her a lecture on how to lose weight by going through physiotherapist, going through some exercises or doing a diet plan or something. I would rather ask her, is it like of a concern to you or does that bother you? So she would say, yes, doctor, I'm worried about this. Then you can think about, I'll connect you to the physiotherapist and dietitian so that they can help you with management of your weight. So in that way, just keep it simple. In RCOG, there are few stations where the role player really gets angry when you comment on a weight, and she's like, I'm not bothered about this. Who are you to give me a lecture on? And they may just get angry, they may yell at you, they may eat up your 1 or 2 minutes in your exam, which are crucial. So it is very important that first of all, we do not agitate them, we do not put them in that anger mode. So rather, we can just ask her if she's aware about weight to height ratio, that's BMI. And if it is mentioned in your case paper, case scenario over there, You can just say that I see that your weight to height ratio is 32 or it's 36 or something like this. Is that correct? So just cross confirm it that way. She would say yes or no and just ask her like, does that bother you? Or she would say, is it of a concern to you? And then you take the station forward. So I'll be dealing with the obesity stations also. So I'll be telling you how to explain them these things. And then to summarize again, is there anything else that you want to add or feel important that I have missed asking you? So in that way, you're on the humble side. You're giving that opportunity to your role player to, allow you to pick some extra points over there, because if you might have missed something, then the role player is like, okay, doctor, I also wanted to know this thing, so can you explain about this? So she may also help you. See, trust me, these role players, they are very sweet. They are there sitting there to help you people to pass this exam. You just have to catch those cues that they are giving you. They have a set of instruction which will guide you through the pass points. So let the role player speak. In that 10 minutes, it should not happen that you have spoken for 8.5 minutes and the role player is just sitting and staring at you. No. The more you allow her to speak, the more crisp and short your sentences are. The role player opens up easily, and then she is able to, communicate with you better. So it is important that you allow her to speak. Okay. And she would tell you, she will tell, okay, I'm having this also, what do you think I should do? Or don't you think, doctor, that this also could be an option? So she'll guide you through those points, right? And about the role player, even if they are angry, if they are sad or something, they wouldn't remain sad for the entire station. At one point they have to settle so that even you could take it forward. So trust me on that, they are there to help you people. Just catch all those cues that they are asking you. There is a reason that these people are given those questions, and that would lead to the pass points. Okay. And to summarize, I didn't summarize in my exam way back in 2019, where November Chennai had given my exam. So there I would feel that maybe I lose time if I sit summarizing things, and I was not that person. But the good points that I knew about myself is my voice tone was good. My communication with the patient was really good. The way I deal with my, like in a clinical practice, also on a day-to-day basis, my patients are extremely happy. So the way I talk to them, I explain. So for me, part three was not that difficult, I would say, because most of the things what is required in the part 3 I was already doing that in my clinical practice. What I had to brush up is how NHS works and what are the expectations that they would have in a 10 minutes consultation, how in a structured way it has to be there. So it is important for us to, if we are losing time, do not sit and summarize the entire stuff again for a minute and lose things over there. If you have communicated effectively, then you don't have to summarize. But if you want to do something quick, it should not go more than 10-15 seconds. Do not lose time on that. You can just ask, is there anything that you want to add? And then based on the information that I've gathered, I'll explain to you the evidence-based management options. And in part 3, the best thing that they would expect you is a mutually agreed safe management plan. What does this mean? You and your patient, you are discussing things, and then you have a plan. So they would say, okay, this is a medical line, this is a surgical line, and then the patient agrees that, okay, I want a definitive treatment. I want to get rid of this condition. I definitely would like to go for surgery. There are set of patients who say that, no, doctor, I would like to retain my, like the womb, and no matter what, you just try out any medications that you say I'm ready to take, but I don't want surgery. So they are going to filter out that time for you. They'll tell you that, okay, don't discuss surgical option and waste the time. Concentrate on your medical line of management. So they are going to tell you that how to shorten your management plan there. Okay. So based on the information that I've gathered, and at the end, it has to be like you mutually are agreeing upon that. And it is, for example, it could be a negotiation station also. So where the patient wants vaginal birth and there are critical things that are happening, and you're convincing her for a cesarean or something, or it is a second stage, whether instrumental versus cesarean second stage, the risk and the complications that are involved in both. And she has heard like somebody having a forceps delivery or something with a bad tear, fecal incontinence, so she doesn't want instrument at any cost, she's ready to go for cesarean. So these things are negotiation station, okay? VBAC wanting a home delivery and how you're convincing her for hospital birth or something. So these things are your negotiation station and the skills that are there. So make sure that these the way you communicate with your role player, they are extremely strong. You have to be clear in your voice. You have to maintain a soft tone. I would say that if you speak with the same tone in all the 14 station also, with the same tone, okay, the same soft tone, it's not going to matter, because if the patient is crying or something also, you're able to convince her with this tone. And with your examiner also, whenever they're asking the question, so if you answer in this tone also, it is okay. If the patient is extremely happy, then obviously we are not sitting with a sad face in front of them, but there are certain things that they're discussing and they are pretty happy with all the things that are happening, and then few concerns here and there you need to tell. So initially they're all cheerful role players, and later on, once you start giving them news in a bit by bit, so that is a sign posting, and then you're telling about all the news, then their emotions may change. But again, I would say be neutral. Do not show any much expression on your face, because the way you communicate, that is extremely important. So try to build that and make your strong point in your exam and your fluency. So from the beginning till the last, all these 3 hours you're going to talk continuously, right? And for that reason, I would say that practicing is important, and knowing sentences, talking to your patients day to day basis, your junior colleagues, teaching your nursing staff, anybody, catch hold of anybody, you can practice with them part three. And whenever you're doing these things, try to, whenever you're practicing your station with your study buddies also, it is important that you time your stations. It would be like, if I talk in this particular speed and this particular tone, I am able to finish my this task in 8.5, 9 minutes. So the extra minute is like complimentary. You may not, but at least you're finishing your task on time. That is important. And at least the gist of the station. It's your communication related to breaking bad news. You have done it really well. But when it comes to management point, maybe sometime like there could be certain things that you may run out of time, but that wouldn't be important in the CA ovary station, I would say. If you have done it really well, your communication, everything is well, and somewhere in the management, when it comes, the bell rings. But you may still pass that station, because the station was meant for the domain of communication. It would be like you are dealing with the role player's emotion, and then you're explaining things correctly to her, and then she's satisfied with that, and then she connects with you, and then you explain all the management things for her. So in that way, it would be more sensible that you have cleared your station in that communication domains and all, because that station was built upon the domain of communications and information gathering. It wouldn't be more on safety, I would say, because obviously you need to discuss that into a multidisciplinary team where everybody is going to plan the management things for her. So a lot of stations would come which are domain based, and your structured discussion, these are all like knowledge based. And there are a lot of stations where even information gathering is extremely important. So they are going to be built in that way. And when it comes to the information gathering, I would suggest all of you that you need to finish your information gathering within like 3 to 4 minutes. Try to do that. And trust me, um, you will be getting good amount of time in the clinical management. Okay, so try to do and keep these questions very crisp and small, and never ask two sentences which would mean the same. Okay, so if you're saying that, okay, may I know your blood group? So, are you aware about your blood group? So, few people or students I have seen that they have the tendency to rephrase the question and put it in front of them. So, same question, but again, two sentences are used. So, try to avoid that. So, are you aware about your blood group? So, just ask that question. And same thing, even when it comes to management, you don't have to repeat everything again. So, I would be telling about how to skeletonize your management properly and put it in a chart form. And closure, again, I've given you a lot of information. This is the leaflet explaining the same. There are certain support groups in NHS where people with similar conditions, it could be like any medical disorders, it could be baby like Down syndrome association, recurrent miscarriages. So they have these support groups who are there, and they discuss about the concerns or the difficulties that they had faced and how they were able to overcome the challenges. So these groups will help each other. All the patients, they help them to understand the situation, deal with the practical situations and how the other people have dealt with, and in that way they'll be able to get a good support. So these are called as the support groups, so you can connect with them. If you do not remember support groups name also, it is okay. There are few standard support groups are there, but otherwise if you don't remember also, don't feel sad or don't keep on looking here and there. Oh my god, I forgot the support group name. No, you just go ahead with your station. So just say I'll connect you with the support groups. And if consultant you were supposed to meet and couldn't turn up, so you can just say that I'll connect you with my consultant or specialist also. And these are the emergency numbers, and if you have any queries, I'm happy to clear them for you. So we will support you in this journey or something. You have to communicate in that way and end your station. Now, when it comes to the domain of communication with patient relatives, make sure this is very important one. The way you introduce yourself, please never forget that. And know where you are, like antenatal clinic, or you are in the inpatient department, or you are in the recovery, and you're in the emergency. So know where you are as your role, like where the role player is sitting. And you should also know why the role player is there, why she has come to you. Something would have been mentioned in your station that she's here to discuss the scan reports with you, which is showing ecogenic foci, and the image would have been given. So you should know that why she has come here. And you also tell her that, okay, I have come here to discuss these results. So either you know that why she's there, or you are expected, so you just tell that. Voice tone, extremely important. The way I speak, the way another candidate speaks, the way another friend speaks, it is different. And that is going to make you stand apart from the rest of candidates. So your voice tone is the one which you have to work upon. I get a lot of students where you don't have to change anything. By default, the voice tone is soft, and they are very well spoken, and they deal with the role player very easily. But I had to modify a few students where um, it would look very blunt, and this has happened to me in the real life scenario also, where a junior, she was there and I was doing some examination of my other laboring patients, and then the patient came with a scan report. We were not getting her heart rate, and then we had sent for the scan and it was an IUFT. And suddenly she just told her, okay, this is the scan thing, and the baby is no more. So she was conversating in Hindi, and she said like, यहाँ पे अभी बच्चा मर गया है, यहाँ पे sign करना पड़ेगा, delivery करना पड़ेगा. I just grabbed her hand and I took her away. I said like, this is not the way you will communicate. What if the patient goes in shock or something? She's not aware of the reports. We don't know. And then she would realize, okay, this is the way you have to show the empathy to the patient. You have to understand that the journey which she was carrying, she was expecting something, it has turned out the other way. It must be really difficult for them. They may not be aware of the results, first of all, and even if they are aware also, they may be in a very difficult situation. So the way you handle them is extremely important in your real life scenario also. I'm telling you, it is not only for your exam. These things will come by default when you're doing that in your real life. The same thing you're going to do in your exam. So it is extremely important that in your day-to-day practice, try to connect with your patients, with your role players here also in your part 3. Understand that what situation they are in, and you have to empathize with them. There is a way that you speak things to them. Every word that you choose to talk to them is important. So make sure the tone of your voice is good, the choice of your words are good, and then try to connect with your role player. In the exam, those 14 people who are there, your examiner or your role player or anything, just forget about different people who are sitting over there. Just focus on your role player, just focus on your examiner. the way you discuss your clinical cases with your seniors or your mentors, or it could be the head of department, any person, your colleague, your friend, the way you discuss your case, it should be that way. When your role player comes, the way you deal with them in your day-to-day basis, please keep it that way. Do not feel that, okay, she is sitting there for an exam, I have to behave differently. No, the more real you are in your exam, that is going to pass you. And try to connect with your role player there. Signposting, there are a lot of things. Signposting means you are making your role player a bit aware that you're going to give certain information which may not be that much acceptable, like cancer, that you're going to tell her that she has an ovarian cancer or something. So you have to do it in a staged manner. That is a breaking bad news, or it could be a difficult news. It could be a talipus, which is not a life threatening condition for the baby. It is not, the baby is not going to be having challenges with surviving or something, but it is a difficult situation to accept a mother with a baby with talipus. It can be certain things like a precancerous condition. So they are not like a bad news, but yes, there are difficult news. There could be negotiation stations, or explaining a particular situation that she is in. And then you're telling about the mutually agreed safe management plan that helps in the decision making. You have to involve your role player in the decision making. Okay, whenever it comes as a team, whenever we are managing a case also, it can be multidisciplinary where you are there. For example, like if I'm doing a laparoscopic surgery, I would there is a case of a fertility as well. It's an endometriotic cyst, her AMH is already low, and what am I going to do? I have to involve the fertility specialist. I'm going to operate her. Do we have to stimulate her before, collect the eggs, and then go ahead with the surgery? Because that is again going to make her image fall down. So we are discussing these things, me and my fertility. But what about patient? Did we discuss with her? Did I involve her in the decision making plan? So your plan management is always between your team and your patient. Involve her in the decision making plan, whatever is it, and only when she agrees for this, you have to go ahead with that, right? And about situations, you have to deal with their mood. Just keep your calm. If she's extremely angry, if she's shouting at you, it is for a reason. Your role player is instructed to do so. Do not get affected. There were candidates during the online sessions, online exam during this COVID. There was a role player who got waiting for 2 hours. She was extremely angry. As soon as the screen appeared, she started shouting at the role player and she got panicked. That that fear carried forward towards another 2 3 stations for her, and she couldn't perform nicely. And after the circuit was done, she was like, because of that station, I got so panicked that I even the easy stations I was not able to talk properly. So understand that these role players are doing their job extremely well. They're acting in such a way that you are getting panicked means you appreciate that. They are there doing like that for a reason, right? They are angry, they're sad, they're upset, they're crying, but it is for a reason. And they are not angry at you. They are just showing that emotion to a candidate who has come to sit the exam. So whatever station it is, you have to deal it with then and there and leave it. Listen to them carefully. As I said, they'll give you all the cues which you have to catch, and that will help you in clearing that asterisk point. About debriefing, whenever scenario is there, bowel injury, uterine perforation, you're telling her about that entire scenario, right? This is called as a debriefing thing. And the duty of candor is something that you have to be open and honest and apologize for the same, that okay, during this process of suction evacuation there was accidental perforation of the womb. So you're telling all these things, injury to the womb, and it was immediately identified, and then the repair has been done. But I have to be open and honest with you. You have to tell this. Okay, try to avoid medical jargons like you have PCO. Don't say like that. So polycystic ovary, this is a condition called as polycystic ovary. So you have to tell that. Okay, this is a condition called as a premenstrual syndrome. Don't say, okay, this is a PMS thing and I'll tell you what to do with this. Give information in chunks. And I was as the online examiners for the mock RCOG exams that happen, and there the role player, she's just sitting, the candidate is talking continuously for 8 minutes. And that was more towards explaining things without full stop, pause, comma, nothing. She's going on explaining, and ultimately, one point of time, the candidate asked the role player, like, "Are you with me? Are you able to understand?" Then the role player said, "No, I stopped listening few minutes ago." And it was very difficult for me as an examiner sitting, because the candidate, she really said that she didn't check her understanding after few sentences, like, "Are you following me? Did you understand? Do you have any questions?" So you need to check that with your role player. You can't keep on explaining things continuously. Just check, just ask, "Any questions do you have?" Then she would say no. And then, okay, go to the next point. So give information in chunks, check understanding in between. Am I clear so far? Or you can ask any questions, and then you go to the next one. And whenever your role play is sitting in front of you, your body language is very much important. So you're not sitting at the end of the chair and trying to lean too much forward, and just keep yourself relaxed. At the same way, you're not falling towards the back end of your chair and chilling and answering those things. No, you have to maintain a good posture. Do not try to nod too frequently. Do not try to use your hands too frequently. Just keep yourself calm. Just understand things. Do not shake your legs. Do not, try to hold on your fingers together. Don't try to be too conscious on the exam as such. Just be normal. Maintain your body posture. Mind your body language, and just have a smooth discussion with your role player. Trust me, this is one of the easiest part amongst all the three, I would say. And let the role player make the decision whenever she is there and you have told all these things. Don't say that, okay, I think going cesarean is the safe and the best option for you. But she would have had other plans. So do not take a decision on her behalf. Let her take the decision. And whatever it is, you have to give a good supportive ending. So at every station, we would be also telling about how to end a station, and give information leaflets and support groups. So this is the way you're going to communicate with them. About the colleagues that you involve, this is important because it's a team effort that we do, right? It could be your consultant, it could be specialist like an IVF fertility specialist, it could be a fetal medicine person, anesthetist, that is the urologist, it could be your nursing staff, your counselor, they could be any person. So multidisciplinary team, these are the team of specialists who are going to help you. And you remember that you are an ST5. I may be a senior consultant at my hospital doing all the injuries, bowel injuries, bladder injuries, doing all so many surgeries, everything all by myself. But when it comes to an MRCUG exam, I am just an ST5. Do not forget to involve your seniors or a specialist. So your consultant is asking you that there is a bladder injury in this placenta previa station during cesarean section or something, and you say, okay, I will repair with all these 1, 2, 3, 4, 5, 6. You are not expected at an ST5 to do these things, but the first step is immediately inform your consultant. Immediately alert the team that there is an injury. So you have to make sure that every person knows this. This has to be documented, and then you have to involve your consultant. This is very much important. So you as an ST5, you are not expected to handle these complications. So remember this, you are ST5 for your exam purpose. And whenever you communicate with your colleagues or something, you are handing over, taking over something, there is something called as an SPAR tool. This is a very effective way you communicate. What is the situation? What is the background? Then what is the assessment of the patient? How do you recommend things? So for example, it is your preeclampsia who is there. So in that situation, she is a primary gravide with some 30 weeks of pregnancy, and the background history of high pressure, she's having headache or something, and on assessment her blood pressure is found to be probably like 150 by 100, 160 by 100 something. So you would recommend giving an antihypertensive, monitoring her symptoms. So this is something like a situation background assessment recommendation. And this way, like these things have been done for her, she's awaited with these results, and now you're going away, your duty is over, you're handing over to the next person, right? So this is how we give the handover takeovers. So this is a SBAR communication tool. And referrals, whenever GP has written a referral to you, you can tell the patient that I'll write back to your GP with your permission, and in answer to what they had referred to her. So there would be a GP letter that referring case of so and so with the history of so and so. Please examine, kindly do the needful test and other things and all. So you will refer back to the GP writing that whatever things you have discussed. And about teaching station, please practice drawing. If you're not a person who draws and explains things, at least for exam purpose, I would say, like, practice something drawing. And skill demonstration, very much important. If you have simulators at your hospital or any instrument for that purpose, I think everybody will have forceps, everybody will have vacuum in their hospital. And these are very important things. And anything, CTG interpretations, the management of patients, teaching simple things to your juniors also, be it knot tying, anything. Even nursing staff, you can catch hold of them and train them. Involve your juniors, practice with study partners, do case-based discussions, everything with your seniors, juniors, whoever is there. So this is very much important, and it will help a lot in your teaching stations. Whenever you're doing it in your day-to-day basis, just keep 10 minutes for yourself where your junior is there or any colleague is there. And in that 10 minutes, you have to teach that one particular station. Practice that in your day-to-day basis. And OSATs are something where they get signed for your competencies and all. So in UK, there are formative, summative OSATs. You must have read in your Part 2 exam also. So nowadays, it's not mandatory that only after three formative you will be getting a summative, but summatives are important to make sure that you're competent. So in that three, at least one should be a consultant summative. The remaining formatives, however you want, you can gather them as such. About patient safety, the name, age, date of birth, NHS number, all these things we check on a day-to-day basis. Whenever a file comes, we check the details and go through the reports. And allergies, Jehovah's Witness, mental capacity stations where we are judging whether she is able to understand situation, she will be able to retain the information. It's a 15-year-old asking for a termination. She doesn't know medical or surgical methods. You're explaining the options available for her. So she is able to understand the options given to her, retain the information, she is able to make a choice for herself. All these things are important. So whenever you're explaining, this is the things that you're going to look for a mental capacity. And safeguarding, it could be a child safeguarding, like there is sexual assault, then children are at home, it is a boyfriend who has done for her, you're worried about children, that could be one thing. It could be like a 16-year-old having a 30-year-old boyfriend, or it is 15-year-old having a 28-year-old boyfriend. So you find that age gap to be more than like 4 years, and you're worried about the child being misused by that adult. So you need to safeguard that, right? So just mentioning about the child safeguarding is important. And about LMP, rule out pregnancy, I've already mentioned. Examination in presence of chaperone with consent. For this, I would say that the male gynecologists who are giving this exam, chaperone is mandatory. It is not like, you cannot do anything without a chaperone there. But for a female gynecologist, also make sure that chaperone is there. At least they are at a distance. At least they are able to hear you, talk you, conversate with your role player. It is important that whenever you're examining a nursing staff, somebody who comes and assists you also, or they can, if there is some language barrier where they can interpret things, whatever. So these people, they are going to be there. Whenever you're telling about examination, you can say that examination in presence of chaperone with the consent. Most of time it's all the verbal consent, right? And only written consents wherever procedures have to be done or something, you may have to take that. Safety points again, episiotomy stations, PPH kind of station where swabs, mops count, all these would matter. Gum clinic referral, so it is a genitourinary medicine clinic where infections, if you're suspecting, to screen for her, to screen for the partner completely, then you may have to refer them for gum clinic also. Um, I think Biba, the mic is on, dear. Just turn it off. Thank you. And call for help. So whenever you know that the consultant is there, okay, and you're doing some procedure, as I said, make sure you call for help. Be it PPH, be it anything. The first thing we do is we want more people to manage the scenario. Do not do everything by yourself. Please call for help. And about midwives, nurse, labor ward prioritization. So when it comes, we'll be discussing them again in detail. The gynae ward prioritization, what has to be done, what has to be spoken, how the flow of every event should be. So what all things you need to focus. So this will be discussing again in detail. And about medications, dosages and all, not mandatory for everything, But medicines, I would see which are pregnancy safe, which have to be stopped, where dosages have to be changed, and which have to be converted to other medications or medicines that have to be introduced, be it either folic acid, be it aspirin, be it like low molecular weight heparin, anything. So new medicines that have to be introduced, and dosages like 5 milligram or something, getting a low dose has to be converted to a high dose depending on scenarios. So these things are important. And suitable contraception, as I said, medical conditions and pregnancy, if they are planning, they have to be in optimum health. So suitable contraception until this thing has been sorted out. There are stations on enhanced recovery program, surgical safety checklist that also we'll be discussing upon. And this is one important slide that I want all of you to know and remember. This is regarding your clinical governance. Any management, I always had a flow of thoughts in my station. So this is the starting introduction I do. My agenda is there, information gathering. Okay, now 3 to 4 minutes are over. Then I'm going to come to the management. Before management, I would say if examination is required, investigations is required, I would say those words. Then when I come to the management, it is again two things. One is a clinical management, one is the clinical governance. So in the clinical management, my flow of thoughts would be like, expectant, is it lifestyle, is it medical, hormonal, non-hormonal, surgical, laparoscopy, laparotomy, conservative surgery, definitive surgery, everything would run in my mind, like where exactly is the flow chart. And then your clinical governance. In this clinical governance, not all these points are going to be in your every station. So it is going to be like, is there a confidentiality that I need to mention in this station? Okay, so 15-year-old who is coming for termination, she wants things to be confidential. Can I mention this in the beginning? Yes. So you start your station only that telling her that, get her into confidence by saying that whatever we discuss, it's going to be confidential. And we are not going to, reveal it to anyone else apart, like if your safety is not compromised. So you have to get that child into your confidence. Okay, FGM station again. You may have to tell her that things are going to be confidential, but only the other things, like for example your healthcare professionals who are there, or the registry which is there, no, there it's going to be entered, but otherwise you're not going to tell everyone that she had an FGM. Things have to be going to be like confidential in that matter. Domestic violence, she doesn't want the husband to know that she has already told you that he hits her, or he's been violent to her. So you tell her that it's going to be confidential. You're not going to write that in her notes until like she gives permission. It's going to be only in the hospital records. So you have to get that thing, get her into your confidence and tell. So confidentiality is extremely important. Then comes all the 7Ds that I generally tell in my all my classes. Whether this station requires debriefing, whether it requires duty of candor. Most of the station require documentation. So you just have to say, I'll document our discussion in your notes in that way. Does my station require DVT risk assessment? Is there anything that I have to report, DATIX or incident reporting? Is there that I have to mention things in discharge summary? Is there anything that I have to further discuss with the seniors? Is there a risk management team involved? Does this patient requires referring to PALS? PALS is the Patient Advisory Liaison Service, where the patient is extremely angry on an outcome. She had a bowel injury, she is extremely unhappy, she wants to raise a complaint by herself. So this PALS is going to address her. So this chart would run in my mind in any station. I would just say, okay, any of these am I supposed to do in this station? Okay, this would require only documentation, nothing. Okay, this person is extremely angry, I would refer to PALS, and this incident has happened, so I have to report this. And she is a high risk for clots, everything. Have I done DVT risk assessment? And important stations like inflammatory bowel disease, it could be anything. Just see whether this would require a DVT risk assessment, and if yes, then when I'm going to start my low molecular weight heparins and all. Anything, all these points are extremely important, and your station is not going to be complete without these clinical governance points running through your mind. Okay, at the end of your station, just remember this slide. Anything does I require to apply this? When it comes to applied clinical knowledge, All of you have strong knowledge. Your GTG is nice, stocks, bash, FSRH, science, figos, everything, whatever is there, you have read that. You have a strong, like a base right now. What is important is how you apply this in your scenario in given short period of 10 minutes. That too, 4 minutes would have gone in your information gathering. In the remaining 6 minutes, you have to do all these things. So I would go in a manner that history I've taken, investigations I'm thinking in my mind. Is it blood investigation, urine investigation, imaging studies? Whatever I'm going to tell her, I would justify. I would say that I want to advise for a urine check to rule out infection. So justifying that I want to do this because I want to rule out infection. I would like to get a full blood count done to look at your hemoglobin levels, look at your blood strength, explain that, justify, just one simple word you need to tell. So this test to do this test to rule out this, imaging study to look if there is any fibroids, if there is any problem in the womb. So if you're just telling that, why you're describing this particular investigation to her, and have a structured approach, put a skeleton of management in your mind. You can write out in your flowchart in your the pencil and the pad that they give you also, just scribble it over there, explain everything and let the role player make her informed choice. And whatever you are explaining, definitely it is all guideline based, so it is all the evidence based that you're going to discuss with her, and that has to be acceptable to her, right? So for example, this is your management, your clinical management and clinical governance. I keep things in my mind like this. Then it is your expectant conservative lifestyle changes, anything basic that you want to do, PCOs especially, or is it like medical management that I need to discuss in this station, or is it like surgical? Is it conservative? Is it definitive surgery? So this is like the flow of thoughts that I would have in my mind. And the same thing I want all of you to understand and explain in the beginning. So in my exam, my role players, she directly said, I don't want surgery, doctor, for this prolapse. Is there anything that you would help me with? And she wanted to talk about pessary in that station. The moment I said pessary, she said, yes, can you tell me more about this pessary? So my role play was so much, leading me towards cutting short my time. And she was telling me that, no, I don't want to waste time discussing surgery. Please tell me about pessary. So she didn't wanted anything on this. She didn't wanted to undergo surgery at any cost. And you know your domains now. And the important thing is your preparation. The way you perform your station, the way you gather information, HOPI, the way you sign post, how you summarize may or may not be required. As I said, I never summarized in my exam. And examination, chaperone, investigations in a structured way, clinical management, check understanding in between, and involve MDT, your multidisciplinary team. You are ST5. So remember that, like for your exam, you just have to be in a position of ST5 and expect all the help from your seniors. And remember your clinical governance points. Okay, this is extremely important. Give information leaflets at the end, give support groups right back to GP if required, involve MDT, involve your consultant. If it is an emergency thing that you want, she's placenta previa and you're just giving some emergency numbers in case of need, and follow up appointment, next appointment when you're going to do. So exam pattern, it's going to be face to face. You have to perform 14 stations in one go. So okay, there is no break in between. And for online exam, there was a break of like after 7 stations, there was a break. But in face to face, it's not going to be there. So that's how we also give exam. And now also the trend is same. Do not get a break. It is just a bell, reading, bell, performing, again bell, reading, bell, and performing. So, but trust me, those 3 hours they are just going to fly. From station number whatever, like 3 you start, you go back and come back and end at station number 2. If you start from station number 8, you finish 8, 9, 10, 11, 12, 13, 14, go back to 1, again come back till 7 and finish. The circuit just gets over. You will not even realize how the time flies. But yes, the stamina is important. I want all of you to perform every station with equal enthusiasm, and giving your 100% in every station is important. You may get exhausted, yes, but remember, these 3 hours are not going to come back again in your life. It is your the chance to pass this exam, give your best, and just push yourself like, okay, I'm done with this station. Chalo, it's the next one that I have to deal with. Okay, the previous station, it went well, good for you. It didn't go well, leave it off. You don't have to worry about the previous station. Please physically, mentally shift from one station to the next one. Leave everything aside. It didn't go well, it is okay, but with that mood, you are not going to spoil your further 5 6 stations, right? Maybe they are the best stations which are there in your circuit and high fetching, where you know everything in that station, but because you carried that mood of your previous station, I don't want you to destroy your next one. So just remember, whatever happens in one station, just leave it. Go to the next one with fresh mind. Start reading your station and then perform. Give your best performance in every station that I want to like you people to perform. Have a smart approach to every station. How to pass this by the tricks, everything will be dealing with that when we are covering all the modules. Hard work is important. Yes, that is important. It's not only your smart work, your hard work is there. Smart work is also there. Dedication is there. Efforts, prayers, everything is going to help you out. The first thing is you have to believe in yourself. You have to believe in us. Whatever you ask for, whatever the help and support we as mentors, we are going to give you. And plus your hard work, the smart work, the dedication, the prayers, the good things that you do in life, everything is going to count for you. Be confident, be smart. Whatever you know from your part 2, just apply clinically for your part 3. Have a strict study partner. It could be a family member, friends, patient, nurse, mirrors, getting one to one done with our mentors. So it can be any person. Just you need to do is practice every day. Never get exhausted with your preparation. Just deal with it. There are students of mine who have even worked till the previous day, because they said like, no, if I staying at home, all these thoughts are coming, so I just want to go to my workplace, finish off my work, come back, eat, sleep, and go to exam. They have done that, and trust me, they have cleared with very good marks. There are people who wanted a break. They have taken for a week, they have taken for a month. Anything is fine. Whatever you feel comfortable, do that. Everything, whatever you want, it can help you to clear your exam. Get extra help from family members who can take care of the household, who can take care of your children, anything. But just make sure that you give your best attempt. I have cleared my part 3 in 1.5 months' time, and that was sufficient because I was still having a 7 month old baby, and one was already a toddler. She was 4 years plus, the other one was 7. But I just wanted to finish off with this exam. And yes, that much because, as I said, that I knew that my communication things are good. I knew that the way I talk to my patients, it's really helpful. And the same thing is going to be applied in the part 3 exam. And I was fresh from my part 2 knowledge. So I didn't have to, I just had to brush up few safety points and the NHS working system, how it is. Because I've never worked in NHS. So I had to gather the information from so many colleagues who are already there. Go to the nhs.gov website, search all the information that I wanted. I went through a lot of patient information leaflets from various hospitals in NHS. So I used to just download and read, download and read. So my laptop was like full of articles and so many information leaflets from them. So that helped me a lot to understand that, you know, how exactly they are working there. Though all my part 3 is everything, all the 3 parts I've given in India, but I knew what was happening in UK at that point of time. I so many colleagues of mine who work there, they helped me out with that. And yes, the information in the NHS government website and all the leaflets released by different hospitals in NHS, everything. So never get exhausted with your preparation. You say that I have to do this now and I'm going to get this degree. You have to get that confidence. And when you're coming towards your exam, practice more of all the recall stations. So me and my study partner, we used to hold one paper, all the 14 stations. So, okay, these are the 14 stations that we are going to discuss. And we would say, okay, just tell me that how you do the breaking bad news. You just tell me how you'll manage this thing. So we would discuss only those key points from that station and go to the next one. So every day we were solving a paper, and then we were doing only the part of that, you know, the performance that is required for that station, and then go to the next one. And we started from the recent most and went backwards. So by the time we were going to the previous stations and the recalls, They were repeats definitely. So if I did day 114 station, the next day I'm doing, it is going to be less in number that I need to concentrate. So the papers went on easily with my study buddy, and then mock circuits you can practice to build your stamina. It could be 5 stations, 7 station, 10, 14. Take up a book and start solving, or take up a paper, start solving them. So you have to do these kind of mock circuits with yourself. You can do with the mentor also, and this is important. So at least you need to get that stamina. If you want to take off from work, you can take, and if you want to practice reading fast, writing it on notepad, if that helps you, you can do that. So try to complete all the task in 9 minutes, I would say. Be perfect, be fluent, be confident right from the beginning, and your ending, it has to be an impressive one. They should feel that yes, she has come here to pass. Your examiner knows the way you start your station, the way you end your station, the feel that you get after completing your circuit. You know that you have passed this exam, and you are like, okay, I'm done with this, and I know that I have passed this exam. This is extremely important. So let us start with the journey. So you should know your mentors for the Raise Academy courses. So this is me here, Dr. Rashmi Patil. I am a consultant obstetrician gynecologist, laparoscopic surgeon here at Bangalore, India. And this is my 2020 February where I had gone for convocation. So I cleared in November 2019. I had attended the convocation of Feb 2020. After that, post COVID, it was all like the ceremony was not held for a couple of years. So I was just lucky enough. I came back to India and there was lockdown. So this is Dr. Geetika Arora. She is practicing in Delhi, and she would be also taking a few sessions of your part three. And Dr. Siddesh Iyer, he is also, he's from Mumbai, and he'll be dealing with the urogynecology module, and he has been an RCOG examiner as well. And the comprehensive step that I would like you people to concentrate as a beginners, the long course has already been started. We are targeting 20 stations, 20 live sessions there. For the regular course, it's going to be 15 live sessions covering 90 stations. So every session has 6 stations. And I do take only 6 candidates in one batch because I want all the candidates to perform. It is only when you speak, it is only when I hear your voice, I am able to correct your tone, I am able to correct your sentence. The same sentence, if I give to all of you, I'm sure all of you are going to talk in a different way. It is going to be the same sentence, but which requires alteration, which requires voice modulation, which requires certain pause. It is like 1, 2, 3 seconds. It may, like, you have to take a pause. Everything is important, and I can correct only when I hear you regularly in every session. So I want all the candidates who come in my batch, they have to be, performing in every live session. So I take only 6 candidates. We have 6 sessions in one live session, and this station everybody has to do it. And every candidates perform in every live session, and it's essential that you practice speaking and not just listening. You can hear 100 station, but when it comes to talking, you may fumble. But when you practice those stations by yourself, when you present those stations by yourself, that is when you're going to get that confidence. And we do have Telegram course groups where it's a dedicated batch wise again. I ask them to solve the practice books there. So we start with one book, then assign task. When as and when they submit the task, the next task is given. Again, they submit the voice task, the next task is given. So that keeps happening. So me and Dr. Geetika, we give the feedbacks in that way. And continuously, if you submit it, it's not like, only one task per day you need to submit or something. It's not restricted. We just want to hear you. We want you to get fine tuned with your exam. And it is only me and Dr. Geetika that we give the feedback. Like, we both are the main mentors here, and we take it our responsibility that we have to give feedback to you all. So nobody else, or it is not like, we are asking candidates to give the feedback to the candidates, because you yourself are in the preparatory phase. So you yourself may not be knowing so many things that are important, but we have gone through this. We have been into this examinations process, everything, sitting on the other side, examining students. We know that what things the RCOG wants, right? So whenever a mentor gives feedback, whenever a student gives feedback, there's a lot of difference, I would say that. and it's essential that you have to practice and unlimited task, anything that you submit. So we go on giving your next task, so you just have to do that. And for the long course that we are there, we do have mixed bag sessions for them, where again 60 stations are done, 12 stations in every session that we do in a quick manner. So I generally take all my regular course students also as a listener for those particular 5 sessions which are there, but the long course people would be presenting them, and all of you could become a part of that. The regular batch students get the access to those live sessions as such. And candidates, they should know or they should practice how to cover the management of each station in a rapid way. So this is what is covered in the mixed bag stations. And Telegram groups, as I said, there also we discuss a lot of points, any articles, anything that you feel that is important, or you want me to share. So all those things are given already. And one circuit I would suggest that all of you would take before your exam. It is going to be a mock circuit. I take online mocks. So if any candidates want, so the course students gets at a discounted offer also. So whenever they want the date, time, everything, we both decide. And I do take the online circuit of 14 stations. It is only the individual candidate. It's like an exam approach. It is continuously happening, and then a detailed feedback and fine tuning that I do for them. Now, the voice library, we have a good source of recordings from our previous batch students, where they have practiced, they have put up good recordings. So those are there only as a guidance. Okay, whatever, it's not like 100% you have to mug them up and tell. I never encourage memorizing things. You have to stand out as an individual person. Come on, you don't have to imitate anyone, be like anyone. They have told like this, I have to tell the sentence in the same way. In the journey of memorizing things, you're losing your individuality. I don't want that to happen. You have to stand out from the crowd. What makes you different? How you talk, how you use the sentence, all these things. So the salt stations are there, but they are as a guide, right? You don't have to copy A to Z from that. They are going to tell you that, okay, this is a station, this is the way that it has to be done. And um, practice books, they are there. Again, we'll be doing solving all these things. Then year wise recalls, everything will be solving in the we have a race warrior group. I think all of you must have heard about this. So continuously we do solve the recall questions in that. So that the telegram group for the warriors, it's for all my batches, they come together and they solve only the recalls in that group. Whereas the batch wise group which is there, we solve all the practice books over there. The live sessions are again different for all the batches, where we are asking every candidate to present. So you present in live session, you present in the telegram for the course for the practice books, you also present recalls in the warriors group. So all the three things are happening simultaneously. And there are a lot of PDFs which are also attained as a arranged as a templates for you to have a quick read also. And apart from this, the study materials are given, the library access would be there till your November exams, and complete approach, like everything that you need that it requires to pass your exams. We are there to help you all. But all I want is a good dedication, hard work, and smart work from you people. So you can join us with this, because you should know that you should choose your course wisely and your mentors wisely, and make sure that you're giving a good and the best attempt for your exam and clearing it in one go. And all of you, I would say, it is just like a it's not be like a stressful period for you all. Just enjoy this phase. It should be kind of a happy situation. So I always say that happy studying, that whichever situation you're in, just take it easy. Your preparation should not be a stress. It causes your thought block, and then the process, it gets spoiled for a couple of hours. So always relax in any situation, study, enjoy the phase of preparation, because this is going to get you the MRCOG degree. And about the course details, I'll share again in the Telegram group. This also would be uploaded in the YouTube channel, and it will be shared again if you want to hear back. For the people who have missed the beginning part of it, there was the problem with the link, so I had to reshare again. So all these things are again uploaded and it will be shared. Welcome all of you, and choose your course wisely, because the people who have cleared like given the part 2 exam, they have cleared recently in the Jan or something, who are having a fresh beginning, yes, understand that why this particular course is important and how it's going to help you, because it's going to concentrate on your individual development, and every student is given an opportunity to speak, and that is how we can correct you. That is one thing. Second thing, for the people who have given the part 2 exam, they're waiting for the results. You can join in the course, and by chance, if the results, if there is something concerns, uh, you will be shifted to the new batch again. So I never, leave the students in that way, or they don't have to pay anything extra. God forbid if there is any negative result also, once they have cleared with their exam, they are getting back their access to the full course again in the upcoming batches. So do not worry on that. For the people who are given the exam also, be confident, be positive towards your result. You can start off your journey. The earlier you start your part 3 journey, the better it is going to be, because with every station that you perform and every day that you're reading or practicing things, you just get to know that you're, the fine tuning happens with every station. So my students, they always say that, the ma'am, the day I submitted my first record, if I hear this now, it is completely different. I can't believe that I have done the same recording, a month back also. That gross difference they would find in their submissions. And the first station that they would submit, a bit of hesitancy or this plus minus would be there. But by the time they are submitting their 10th, 15th, 50th station or something, they'll be so fluent. Just have to correct, like, few points here and there, and they're done with that. But the first station would be like, okay, this you need to tell in this manner, this point has to be conveyed in this manner, this is a medical jargon, dear, you need to change that. There are so many corrections in the first station, but as and when they are submitting their station, and like my students, when they hear back their own submission of day one, most of them, they have told, like, there is a gross difference that they find in the way they present themselves, and that is what is important. So all of you, I want you to be confident, I want you to be fluent, and I want you to enjoy this part 3, because this is the way, you're going to practically apply all the things that you have studied in your MRCOG journey, and this is going to make you stand out from any other practicing obstetrician or gynecologist, the way you communicate even in your day-to-day life. It's going to help you, and part 3 is just going to refine you. You'll really understand and notice that change or the difference in your clinical practice also. So all the best. Thank you so much. Part 2 results, yes dear, that is also available. We do have different batches that come up, so it depends on the number of students that they are getting enrolled. So right now we are going to start with the July batch, but I would say that the earlier you join now, the preparation you can start, because by the time the results come, everything again, the at least a month would be gone, because we are expecting by 31st July. So this entire month would have been gone, and then getting in the pace with others, that may be a little challenging. So the earlier you kickstart your preparation, it's never harmful. Trust me on that. And always be positive towards your result is what I say. But yes, after that again, the upcoming batches would be there. There would be a like, the short course batch as well, where is it's a kind of a fast track batch, where we'll have two sessions, two live sessions in 1 week. But that wouldn't be you'll be getting to do 1 or 2 modules every week, so it is a kind of a fast track course that happens. It happens at a different pace. And a day do we need to give exam in November? The number of hours, trust me, it's not fixed that way. Someday you get to read 2 3 hours, someday you may read 5 6 hours, someday you may read for 1 hour. It doesn't matter. So it is like daily basis, speaking, practicing, station performance, everything that is important here. It's not like fixed number of hours as in your part 1 and part 2 that you have to sit and study. The best way to do part 3 is go to your workplace, deal with your patients, deal with your colleagues, deal with your nursing staff, your juniors, teach them. Just go out and start doing your part 3 with your actual role players. That is important. Okay, just enjoy that phase. You don't have to sit with your books like part 1 and part 2 for your part 3 exam. Okay, I hope these things are clear. And thank you so much for joining in. I hope all of you have benefited from this introductory session. So I'll be sharing with the course details again in the group. and do join in. Have a great time. Downloading, see, part two, whatever things are there, that is fine. But PILs, yes, all these PILs are there in the free group tier. There also I have uploaded, and in the RCOG website also there is a patient information section where all these PILs are freely available. So that also you can download, or in the file section of the group also you'll get it. So that those materials are fine. That PILs and all you can just gather and keep it as a folder. And in the course also in the library, these PILs are there. So nothing to worry. You don't have to spend so much things on searching the materials, which I did during my preparation. So I have sorted things for you people over there. I've arranged all those things for you people. Free group, the Raise MRCG Part 3, that is the free group. Okay, do take care. All the best. Lovely having you all. Bye, dears. Take care. Good night. Thank you. Bye bye.
Thank you, ma'am.
Thank you. Thank you so much. Bye bye. Good night.